this video focuses on the case-taking instructions given by Dr. HAHNEMANN in his Organon of Medicine. Let us start with an intro. Master HAHNEMANN was the first person to realize that the whole man is sick and not the organ. Hence, he advocated a holistic approach while treating a person who is sick. In Medicine of Experience 1805, he has described the method of investigation of a sick man, and thereafter in almost each edition of Organon of Medicine, he has progressively unfolded the methods of knowing the patient. It is imperative for homeopathic physicians to understand and implement those instructions given in aphorism 83 to 104 in Organon of Medicine. Let's analyze and summarize the following aphorisms. Since this is a repertory topic, I am explaining it in brief. Let us start with aphorism number 83. Now, to summarize aphorism 83, every examination of a case of disease should be individualized. Since each case is unique in all respects, only the individualized approach can explore the true picture and help a physician to arrive at a totality in its true sense. The concept of individualization holds that every individual is different in health as well as in disease, and hence every case has to be examined individually, giving importance to its unique expressions during health and sickness. The individual is to be studied in his own environment, that is family, work and society. The physician must be unprejudiced while examining the case. Let's move on to aphorism number 84. The instructions regarding clinical interview, sources of case recording are given clearly in this aphorism. It is a very delicate yet dynamic situation where a physician should remain attentive so that disclosures are received properly. Role of bystanders is also very significant, especially when the patient is a child or he is unconscious or not able to communicate due to various reasons. Therefore, there are three main sources of case taking: the patient himself, bystander or the attendant with him, and physician's own observations. Instructions about recording are very clear from this aphorism, that is, the physician advises the patient and bystanders to narrate the history properly and slowly so that he notes down all the important parts of narration. Aphorism number 85. Here, the physician must start every new circumstance with different lines so that when he tries to connect the dots of the case narrated by the patient and the attendants, he can do so easily. In aphorism number 86, it is mentioned that the physician must carefully inquire the symptoms in detail. The symptoms should be completed in respect to each of its components, that is, location, sensation, modalities and concomitants. Aphorism number 87. Now, the summary of aphorism 87 is: a physician should not ask direct questions, leading questions or multiple choice questions. Such questions do not help the patient to think, and he tends to answer in a way which does not assist the physician to form a true picture. They do not bring useful information. Let's summarize aphorism number 88. The physician should try to understand the physical and mental makeup of the patient by inquiring into the various bodily functions, emotions, and intellect. Thus, he makes a note of mental and physical generals. In the case of a female, the details of puberty, menstruation, pregnancy, delivery, lactation, menopause, as applicable to age, should be noted down. According to aphorism number 89, after the patient has finished his narration and answered all the queries of the physician, a tolerably perfect picture of the disease should emerge. and if the physician still feels that he should get more information, he is at liberty to ask more precise, more special questions in order to complete the picture. Here in this aphorism, feigned diseases is mentioned. Let's study what feigned diseases is. When a person imagines falsely a disease manifestation and presents the picture with some specific purpose, the condition is called feigned disease. Aphorism number 90. The physician observes and makes notes of patient's behavior, facial expressions, dullness, way of answering, and other details of findings of physical examinations. He should contrast these with the symptoms that existed during the healthy state to differentiate whether the findings are a part of disease or a part of his constitution. This also helps to understand the true concomitants of the disease. According to aphorism number 91, physician should investigate whether the patient is under treatment, whether he has been taking suppressive or palliative mode of treatment. If he has been under treatment for a long period, the presented picture might be combined picture of the disease and the drugs. So in that case, he should try to elicit the picture before the actual treatment had started. If the patient cannot remember because of lapse of several years, physician advises them to discontinue the present treatment for some time so that the real and pure picture might emerge. Aphorism number 92. In a disease of rapid course, the physician should be satisfied with whatever picture is available on the first inquiry and on observations. Sometimes this rapid course might have started due to the effect of some injurious things or drugs. Whatever might be the cause, the physician should not waste any time to go into unnecessary details but should attempt to erect the totality of the combined effect of medicinal and original disease. The product of medicinal and original disease is called conjoint malady. Aphorism number 93. Sometimes the patient comes out with all the details without any hesitation, whereas in some cases it needs skillful questioning. However, when the patient is assured about confidentiality of the data, he comes out easily. According to aphorism number 94, a careful investigation regarding occupation, mode of living, diet, domestic situation, etc., that is, man and his environment, might reveal the exciting and maintaining cause of the disease. This is important in understanding the disease and treatment of the disease and in health promotion. Aphorism 95. In the case of chronic diseases, due to long duration of suffering and complaints, the patients think that only a few symptoms are a part and parcel of their general and normal functioning of the body. Hence, they do not share these symptoms with the physician. These symptoms are called accessory symptoms. Patients fail to mention these accessory symptoms because they are so used to these symptoms that they accept them as a part of their health. They do not think that it is important to mention them, thinking that these might be minor and insignificant things. They think that these symptoms do not have any connection with their main complaints, hence they need not to be mentioned. Aphorism number 96. In the above paragraph, Dr. HAHNEMANN has sounded alertness to the physician about hypochondriacs and hypersensitive patients. Hypochondriacs are those patients who have a morbid anxiety about their health. Very often, they present with an imaginary illness. Whereas hypersensitives are those patients who exaggerate their sufferings. They describe their symptoms as if they are troubled or affected too much, even if the symptom is a minor problem. The hypochondriacs and hypersensitives differ from insane persons who suffer from mental disorders. They also differ from feigners who malinger, that is, those who act sick in order to avoid something. Aphorism number 97. Some individuals who do not take much interest in describing their ailments can be called stoics. The reason for not narrating their complaints fully could be lack of interest or laziness, false modesty, mildness, weakness of mind, or lack of capacity to describe. Patients who do not understand the need for telling each and everything about health and disease. Aphorism 98. In this aphorism, Dr. HAHNEMANN has also mentioned that complete and true investigation of a chronic disease demands the following: special circumspection, tact, knowledge of human nature, caution in conducting the inquiry, and patience. According to aphorism number 99, the investigation of an acute disease is easier because of the following reasons. All the changes in health are fresh in the memory of the patient, the symptoms of the diseases are more prominent, and due to recent origin and nature of disease, the symptoms come into notice of the physician without much difficulty. According to aphorism number 100, in case of an acute disease, that is epidemic and sporadic diseases, a physician should study the disease carefully and examine it properly without being biased by earlier experiences. According to aphorism 101, in epidemic cases, the totality of diseases is only known after the physician makes a study of several cases, since the study of one case alone would only provide a partial picture of the disease. However, an experienced physician might get a complete picture by studying a single case of the epidemic, just as an experienced person can perceive a complete picture by seeing a part alone. According to aphorism number 102, after a physician has studied several cases, it would be easy for him to get a clearer and more complete picture. He should then write it down under general symptoms and characteristic particulars. These together constitute the totality of epidemics. To know the complete picture of any epidemic, a physician must study its symptom in several patients of different constitutions. A medicine selected on the basis of this final totality is known as genus epidemicus. It can be used for treating all the persons affected by the epidemic and also as an preventive medicine. According to aphorism number 103, fundamental miasms that affect several persons should be studied separately in various individuals. These partial pictures, when combined logically, would form a complete picture of chronic miasmatic disease. On the basis of this final complete picture, an anti-miasmatic medicine can be selected. This medicine would help several persons suffering from these miasmatic diseases. According to aphorism number 104, Dr. HAHNEMANN suggested some steps to the physician to enable him to do best in the case, and they are: physician should arrive at the totality by picking out all characteristic symptoms. He should select a homeopathic remedy which covers most, that is similimum. When the patient reports back after a stipulated time, the physician should ascertain the effect of similimum by studying the change in the state of mind and body. At each follow-up, he should look at the case as a fresh one and try to find out the change in the symptoms reported during the previous visit. The symptoms which are relieved can be struck out so that he could know what still remains. He also attempts to find the new symptoms during the course of treatment. That's all about case taking. Thank you for watching.